If you've been feeling exhausted, achy, foggy, or just off, vitamin D deficiency is one of the cheapest things to rule out. But here's what nobody tells you. The exact same blood test your doctor orders for around $150 to $250 after the office visit, you can order yourself online for as low as $29 in 2026. Same lab, same test code, same accuracy. No appointment, no referral, no insurance hassle. In the next 9 minutes, I'm going to show you exactly how it works, what the price actually is, what your results mean, and the link in the description goes straight to where I order mine. The test you want is called 25-hydroxy vitamin D, sometimes written as 25-OH vitamin D, or vitamin D 25-hydroxy total. That's the gold standard. It measures the form your liver produces from sunlight and supplements, and it's what every legitimate lab uses to diagnose deficiency. Avoid any test labeled just vitamin D 125-dihydroxy unless a doctor specifically asked for it. That one measures something different and isn't what you want for deficiency screening. When you order online, make sure the listing says 25-hydroxy. That single detail matters more than the brand of the lab. Let's talk actual numbers. As of this video, the standalone 25-hydroxy vitamin D test on the major direct-to-consumer lab sites runs between $29 and $59. Walk-in lab pricing through partner networks like Quest and LabCorp tends to sit around $39 to $49. If you bundle it into a basic wellness panel, you're looking at $79 to $129 for vitamin D plus thyroid, iron, and a metabolic panel, which is often the better value if you haven't had blood work in over a year. Prices shift, so check the link below for the live number before you order. Here's the whole process, start to finish. You go to the site, add the vitamin D test to cart, and pay. A licensed physician on their network reviews and signs off on the lab order. You never speak to them. You get an email with a lab requisition, usually within minutes. You walk into a Quest or LabCorp location near you, sometimes no appointment needed, hand them the requisition, or show it on your phone, and they draw your blood. Results land in your patient portal in 2 to 5 business days. That's it. The whole thing takes about 10 minutes of your time. Results come back in nanograms per milliliter, written as ng per ml. The widely cited reference ranges look like this. Under 20 is generally classified as deficient. 20 to 29 is often labeled insufficient. 30 to 100 is the range most labs consider sufficient. Above 100 starts raising concern about toxicity from oversupplementation. I want to be clear though, I'm not a doctor, and these ranges are general references, not personal medical advice. Your number means different things depending on your age, skin tone, location, and health history. Use the result as information to bring to a real conversation, not a self-diagnosis. Honestly, not everyone needs this test today, but if any of these apply to you, it's worth the $29. You live above the 37th parallel, so think anywhere north of Virginia in the US. You have darker skin, which produces less vitamin D from sunlight. You work indoors most days. You're over 50. You're overweight, since vitamin D gets sequestered in fat tissue. You're on certain medications like steroids or seizure drugs, or you've had ongoing fatigue, bone aches, low mood, or frequent infections without a clear cause. If 2 or more apply, testing is genuinely useful. You don't need to fast for a vitamin D test by itself. If you're bundling it with cholesterol or glucose, then yes, fast 10 to 12 hours. Don't take your vitamin D supplement the morning of the draw, since it can artificially inflate the reading for a few hours. If you've recently started supplementing, wait at least 8 weeks before testing, because that's roughly how long it takes blood levels to stabilize. And don't retest more than every 3 to 4 months. Vitamin D levels change slowly, and earlier retesting just wastes money without giving you new information. I want to be straight with you. Direct-to-consumer testing is great for screening and tracking, but it's not always the right tool. If you're having severe symptoms like bone pain, muscle weakness that's getting worse, or you've had a recent fracture, see a doctor first. If you have kidney disease, parathyroid issues, or you're pregnant, you want a physician interpreting results, not a portal. And if your test comes back significantly out of range, either direction, that's a real doctor conversation, not something to fix with Amazon supplements. Online ordering saves money on the easy cases. The hard cases still need humans. If I were starting from scratch right now, here's the move. Order the standalone 25-hydroxy vitamin D test if you've had recent blood work. Bundle it into a basic wellness panel if it's been over a year. Use the link in the description. It goes to the lab service I've personally vetted for price and turnaround. Get your draw within a few days. Read your number against the reference range. If you're under 30, talk to a doctor or pharmacist about a supplementation plan. If you're between 30 and 60, consider modest maintenance. Retest in 3 to 4 months to see what's actually working.